Finding out your friend is self-harming can feel overwhelming. You might feel shocked, scared, or just totally unsure what to do next. I'm Dr. Marianne, a clinical psychologist, and in this video, I'm going to walk you through exactly what self-harm is, why someone might do it, and what you can do as a supportive friend without burning yourself out in the process. Hope you find it really useful. If you do, please like and subscribe for more. Personal reflection. When I first heard of self-harm, I still remember the first time I learned of the concept of self-harm for the first time. It was 2001, which I appreciate to you might sound pretty vintage right now, but I was watching Hollyoaks. One of the main characters, Lisa Hunter, was secretly hurting herself, and at the time it was really shocking. I couldn't understand why someone would choose to hurt themselves on purpose. These days, of course, it's pretty unlikely that most teenagers would get to the age of 19 without having already heard of self-harm, perhaps at school, through friends, or even on social media. But I also need to say that part of me actually feels really sad that you guys didn't get the chance to get to 19 before you first heard of it too. And because it is such a big and important topic, you might feel like you've already heard a lot about it, but that doesn't necessarily mean that you know how to help, and that's where this video comes in. Over the years, self-harm has shown up more in UK culture, in shows like Skins, My Mad Fat Diary, EastEnders and Waterloo Road. Sometimes these stories are told with care, and other times it feels like not so much. But what we know is that real life often doesn't get wrapped up in neat 30-minute episodes, and that when someone you care about is hurting, it can feel very real, worrying, and sometimes all-consuming too. What self-harm is and isn't. So what is self-harm? It's often a way of coping, a way to deal with emotional pain, anxiety, numbness, or overwhelm. Some people say it helps give them a sense of control. Others say it helps them control something. Anything. It is important to be clear, though, that self-harm is not always about wanting to die. And it's understandable that people might assume that self-harm means someone is suicidal, but actually that's not always the case. For many people, self-harm is a way of staying alive, a way of managing huge feelings when they don't know what else to do. Of course, though, there can be overlap, and it's always worth taking seriously. But it's also important not to jump straight to thinking your friend is suicidal, because they might not be. The best thing you can do is to try to stay calm and kind, and in doing so, help them feel less alone. And just to be clear, it's not for attention, it's for relief, and that's a big and important difference I'll come back to very shortly too. What to say and what not to say. If your friend tells you they're self-harming, you don't need perfect words, just try to stay kind. You could say something like, "That sounds really tough. I'm here for you. I didn't know things felt like that. I'm glad you told me. I don't really know what to say, but I'm here." Try to avoid things like, "You're just doing it for attention, but you always seem fine." You need to stop doing that. Even if you're scared or unsure, just being calm and non-judgy really helps. Clinical experience, why compassion still matters. When I worked in youth prisons, I saw a lot of young people who were self-harming. And I learned that people can be incredibly resourceful when they're trying to hurt themselves, using anything they can get their hands on. And that can give us really important information about just how much emotional pain they are in. I've heard people say things like, "If you're too nice to people when they self-harm, they'll just do it again for the comfort and attention." I have to say I completely disagree with that. If someone is bleeding, no matter how it happened, they do still deserve care. And the feelings behind it? Well, they need care too. Withholding kindness does not stop self-harm. It just layers on more shame. What helps is safety, compassion, and connection. Anger, anxiety, and being heard. One thing that doesn't get talked about nearly enough is the link between anger, anxiety, and self-harm. Anger isn't always shouting or violence. Sometimes it's a quiet inner feeling that something isn't fair, or that you've had no say in something that really mattered to you. If someone's grown up in an environment, or for that matter, been in a relationship or a friendship where they weren't allowed to speak freely, say how they feel, or have any control, then their ability to express anger can get shut down. And when anger can't come out safely, it often gets turned inwards. For some people, that might show up as self-harm, a way of connecting with anger and pain in a more controlled way. where they can predict the outcome even though it hurts. Whilst self-harm is a strategy and it often might feel like the best that someone has got available to them at that time, it's not what we would consider an adaptive strategy. Therefore, it's something we want to encourage people to step away from. And so, of course, it's not something we want to promote or suggest. And of course, we want to teach people other ways of coping so they can step away from self-harm. But it can help us understand where that behaviour is coming from and shows us just why compassion matters so much. One way you can support a friend is by helping them practice how to have a voice safely again. And you can get started on this in really small ways. Let them share their opinion about music, schoolwork, relationships, anything. Show them that their thoughts are worth listening to and that they won't be laughed off or shut down. Having someone who lets you exist without judgment, who encourages you to raise your head high and be enough just as you are, well, that can be incredibly healing in itself too. It is important to remember that you are not their therapist. You are their friend, and that's a very important role. But you can help your friend feel more human, more valued, and a little less alone. What happens when someone gets help? Support for self-harm might include therapy like CBT, which stands for Cognitive Behavioural Therapy. This helps people understand and challenge difficult thoughts and behaviour patterns. Some people might be offered something called DBT, Dialectical Behaviour Therapy, which is especially helpful in managing strong emotions and in building safer ways to cope. If someone has been through something traumatic, like abuse, bullying, or losing someone close to them, they might be offered CFT, Compassion Focused Therapy, or EMDR, Eye Movement Desensitization and Reprocessing, which are designed to gently process emotional pain and trauma. In some cases, professionals might suggest an assessment for ADHD or autism. These are neurodevelopmental differences that can affect how people process emotions, handle change, or experience the world around them. Getting assessed and even diagnosed doesn't mean something is wrong, but it can help unlock better support, understanding, and self-compassion. Some people might also be offered medication, especially if self-harm is linked to anxiety or depression. None of this is about punishment. It's about healing and understanding and finding new and adaptive ways of coping with things in future. Let's talk about you. What if you feel traumatised too? If you have seen a friend in crisis, especially if there was blood, panic, or you felt like it was all on you, that can be traumatizing too. You might be feeling shaky or on edge, having intrusive thoughts, flashbacks, or upsetting images, avoiding reminders of what's happened, struggling to sleep, feeling scared, guilty, or overwhelmed. These can be signs of post-traumatic stress, especially if they last more than a few weeks. If that sounds like you, please speak to a parent, a trusted adult, and/or your GP. They can help you access local NHS or mental health support because you most definitely matter too. Looking after you. Knowing your friend is hurting can really affect you too. You might feel helpless, confused, sad, or even angry. And you might be surprised to hear me talk about anger and to say that that's normal and okay. Remember, anger doesn't always look like rage and violence. It is essentially just an important communication that something is happening or has happened and it's not sitting right. You're allowed to have your own reaction, and it's incredibly human that you do. Remember that not all emotions feel nice, but that it doesn't make you a bad friend for having them. Please do talk to someone about the impact on you, a trusted adult, a teacher, counsellor, or helpline. You don't have to carry this on your own. Closing message and call to action. Remember, you're not their therapist, you're their friend. And just by being there with care and compassion and by watching this video, you're already doing something incredibly important. Check the details on screen for really useful sources of support. And if this content has resonated with you or you've got ideas for future videos, I'm listening. Please do drop a comment and like and subscribe for more. Thanks for watching, and please do stay kind to yourself.